So I'll admit now.
Welcome, everybody. We'll just give everyone a few minutes just to come in and then we'll start the meeting. Okay, welcome to our participants today. We will get the meeting started. I'll just begin by letting everybody know that for this session, which is session one, there will be interpretation available in Arabic, English, and French. Next slide, please. So welcome to the ATACH Technical Meeting for the Health Professionals Association for Climate Action, Engagement and Opportunities in ATACH. I'm Dr. Kimberly Humphrey from Doctors for the Environment Australia, and I will be chairing this first session. My colleague, Professor Eugenia Kayak, will be chairing our second session later today. Next slide, please. So today, our session objectives, we're going to be talking about the importance and benefits of the Health Professionals Association membership in ATACH. I'm very, very passionate about this constituency because I think that health professionals are such a valuable bridge between policy and practice. And there's an awful lot that health professionals can lend in this space. And we also know there's an awful lot that health professionals need as well. So this is about building those bridges. We will be sharing an update on the HPA activities that are already underway and also identifying some engagement opportunities for HPAs in ATACH as well. Next slide, please. This is our meeting agenda today. So as I've said, we will do the overview, we'll go through some of the current priorities and activities, and then we'll have a really nice amount of time to have an open discussion to bring forward some of the things that need to be discussed and look at the way forward as well. And then at the end of the meeting, we'll go to next steps and close. Next slide, please. I am going to hand over to Eleanor now to just give us an overview of ATACH and the HPA constituency. Thank you.
Thank you very much, Kimberly. So basically, from my side, I just wanted to mention the importance that we provide to the health professional associations in the ATACH. Basically, just for everybody to know, the Alliance for Transformative Action on Climate and Health has a very complex governance and operational mechanism that is summarized in this slide in front of you. But basically, everything that the ATACH does is aiming to advance implementation at country level. So basically, the mandate that we have from WHO is to work close to countries to understand which are their needs and priorities to move to action. Basically, in the governance mechanism, we have a steering group that is composed by different constituencies, and one of those is health professional associations. So basically, through a system of expression of interest, we designated Kimberly basically and the institution that she leads to represent the health professional association constituency. And I think that we would like to work very closely with them to make sure that we reach out to as many health professional associations as possible to move this implementation at country level, because we recognize the important role that health professional associations have in basically leading this action. So basically, Doctors for the Environment Australia is trying to reach out to more health professional associations, and that's the purpose of this meeting, just to make sure that we identify which are the entry points that could be basically strengthened for these associations to advance this action. And I recognize that there are many important people in this meeting, including Fiona Atsit also maybe at the end of the meeting, once the presentation is done, we could also hear from her if she has any specific recommendations based on her experience. With this, back to you, Kimberly.
Wonderful. Thanks, Eleanor. And next slide, please. So just a little bit of an overview of Doctors for the Environment Australia. So Doctors for the Environment Australia was established 25 years ago. As it sounds, it is a group of doctors who care very greatly about the environment as well as health and climate in Australia. We work with communities and health professionals to respond to the health effects of climate change through a whole heap of different things. So practical support, education, and also by encouraging strong action to reduce pollution and protect the environment as well. Next slide, please. So as outlined, we do represent the HPA constituency, and there are quite a few things that we have undertaken since taking on that role. And I am aware that there may be some people in this room who are members of organisations who are new members of the HPA constituency. So welcome to you. And if you are with an organisation who has not yet joined, please do come and join us. There is a lot we need to do. So since we took on this role, we have put together 2 workshops. One was in person and one was online. And that was really as global as we could make it. So endeavouring to get national and international HPAs from across the world, not only in medicine, of course, but nursing, allied health, public health, the whole spectrum of health professionals that we could get to those meetings. The purpose of those was both to socialise the ATACH work, so introduce what this is to health professionals who were interested, but also to canvass what are the things that health professionals need or think their systems need at a country level? What are the things that are different between countries? Because there is an awful lot of diversity across our globe. And what are the things that health professional associations think that globally we can lead and lend to each other to strengthen that work at a country level across the world? We did also undertake an online survey of DA members in Australia as well as part of this consultation. We put together an article on this work and particularly the consultation, and we have done extensive outreach via email and events such as academic conferences. So we did have a presence at COP30 last year, and this year at COP31 we are planning to do quite a lot as well and launch a position paper, which I will speak about shortly. Next slide, please. So the priorities that came out of this consultation, and this was really fed into not just, of course, by Doctors for the Environment Australia, but anybody who attended that consultation. And that was open to both existing HPA members, but also we had a number of people attending who then joined the Health Professional Association constituency following that. So this is what the priorities that came out of that consultation looked like. Number one, to really build that trusted and effective global network of HPAs. So when we took on this role, we did not have a significantly large constituency. It is growing, but there is a lot of overlap as well between this constituency and other constituencies, such as the NGO constituency as well. So there is a real emphasis on building that trusted and effective global network. We do have a fairly strong representation from the global north. So we have good representation from Australia, from the UK, from Canada, but we are still very much looking at and encouraging and supporting partners from across the world to really get that global picture of what HPAs need and what they look like as well. Our second priority is to strengthen and position this constituency as a distinct authoritative voice within ATACH's global work. It's been mentioned a few times that health professional associations have a really unique place at the forefront of care and understand the impacts of climate on health systems, but also understand the impacts of health systems on the climate as well. So it's a very valuable voice, which we are really looking to try and amplify and bring to all of the work that happens within ATACH. And finally, a really key priority is to make visible the climate risks and contributions of the global health workforce. All of you are working within these systems that are threatened by climate change and are working very hard in a workforce to combat those impacts as well. There's a lot of stories to be told, and there's a lot that can be learned and leveraged across the constituency and also lent to other parts of ATACH as well. So that is the third priority under this work too. Activities, there's a number of things that have gone underway. So I have really focused on that consultation quite a bit. We also attend steering group meetings as DEA in an advisory role. We are working on a number of climate and health publications. As I mentioned, we are planning events as well to really elevate this work. And the big piece of work that's ongoing at the moment is developing a position statement that's aligned with the ATACH 2024 to 2028 strategy with a view to launching that later in the year and planning a number of events around that. That position statement is really looking to reflect what is a health professional association? Because this is a question that does come up with some frequency to say, how are you different to a non-governmental organisation? Why does this particular perspective matter? And what are the priorities for health professional associations in this work? So this is a position statement that's currently being developed, and as I said, will be launched later this year. Next slide, please. So we are going to open to discussion because we want to hear from everybody on this call. Some of the things that we'd like to hear about, the role of HPAs. As I just mentioned, why do health professional associations matter in this work? Some of you may have really interesting and unique perspectives on that, and we'd like to hear them. We've mentioned our priorities. We haven't gone really deep into the weeds and all of the different things we think we could be doing, and there are a lot of different things we could be doing. But what are your ideas and suggestions for action? What can we best do in this constituency as health professional associations to advance the work of ATACH? How can we better build this network? And this is absolutely crucial because we need to get more people into this constituency, particularly who are representing more diverse opinions from places that are not within the global north, for example. Some of the ways that we've looked at building this network is by cold emailing many different organizations, but also by reaching out through our connections as well to encourage different groups to join. One of the barriers that we see is that there are many different health professional associations who are working very hard on many different things and don't have a lot of capacity or resources. The question they ask themselves is, why should I be part of this constituency? Why should I engage in this work? We would be very interested to know how we can help encourage such associations to be part of our work, and to really show them why it's worthwhile and what is in it for them. And finally, what are the best ways of working together? What are the things that we can do that can help us get as far as we possibly can within this work as well? So I would like to open the floor. And before I do so, Fiona, as mentioned, I can see that you're online. I'm not sure if you would be happy to say a couple of words.
Thank you very much.
Welcome.
Great to be here this morning. I mean, I think, Kimberly, you've really said it all. It was a fantastic introduction. And I think the challenge is always, as you've reflected, it's a very fragmented world. And how we really get that value, how we really demonstrate to people that this is something that they should join is really, I think, the key. So I think for me, what I'm also seeing is that so many professional groups are really thinking about how they can intersect with some of the other interest areas. So I think it might be worth thinking about not just professional groups, but how we link in to the other agendas as well. So I think those are my main points. Thank you for asking.
Fantastic. Thank you so much, Fiona. So what we will do now is we'll open the floor to discussion as well. And I would like to welcome, there are a number of people from the Doctors for the Environment team here as well. Parlis and Sarah and Eugenie, who will also be taking notes and participating in this meeting as well. So the floor is open, hands up, and we'd love to hear from you. What I might do whilst everyone is getting their ducks in a row to have a bit of a chat is I might pass to some of the members I just mentioned from our team to see if they have anything else that they'd like to add as well. So I know, for example, Paulus, who is one of our members in Doctors for the Environment, has recently attended some of the events that were around the World Health Assembly and made some connections there as well. And Paulus, it would be very interesting to hear your observations, if you're able to, of course, around some of the conversations that you had or some of the perspectives that you gained from that attendance.
Yeah, hi. Morning. Thank you, Kimberly. Thank you to everyone else for coordinating this meeting. Yes, I'm actually currently, I'm a doctor in Australia, but currently in France at the moment on some long service leave, and was able to attend the World Health Assembly in Geneva a few weeks ago, which was wonderful to, obviously I sort of spent most of my time in the climate and health streams and heard from many, many very motivated people. And certainly, as you mentioned, Kimberly, it sounds, it's obviously very much a lot of the conversation is around the implementation phase now of this nexus of climate and health, and how do we know what we need to do. The technologies exist, they're relatively affordable, there are international infrastructures in place or being worked on from a finance point of view, etc. But how do we get that on the ground and moving? And certainly for me, and I know I've talked about this in other circles with some of the people here, in my day-to-day work with people in healthcare, when we're seeing the healthcare that we're giving having an impact on the environment in a negative fashion, and knowing that impacts negatively on our patients, how do we elevate that voice of health professionals to sort of say, like, for example, we really need to see the changes start to filter down to the ground now, and we need kind of those ideals to be put into practice now. And obviously that experience in Australia is going to be quite different to that experience in other parts of the world. And I think that's a really critical element, is how do we bring all those voices together with lots of different competing priorities. But then also how do we get that those commitments put into play now from our various governments. And it was great to hear some of the people talking about that, but hearing from health professionals is going to be really key, I think, for that. Thank you.
Thanks so much, Paulus. Ina, hello. I can see that the raise hand's not working, but please, yes.
Hi, how are things? I'm not sure which way I joined, and I'm afraid I might even be open twice here, so I could get a feedback. But anyway, apologies for that. I'm joining. Well, I came in through from the Standing Committee of European Doctors, CPME, and I'm just really just trying to find out really what the benefit would be for the work we do in relation to this. I'm just wondering about, first of all, the purpose of this, because my background is a consultant in public health medicine in Ireland, but really focusing on climate change adaptation, which is the urgent health protection function, really protecting people from the climate changes that are already occurring. And obviously where sustainability and zero carbon are essential, but they're unfortunately not sufficient. And so the work in adaptation is here and now, and I don't see much effort being put into that in many ways. Now, I'm not sure if this particular organization is involved in adaptation, or is it just purely in the zero carbon side of work, because while that is a public health intervention, its effectiveness is yet to be demonstrated, if you know what I mean. And so it's obviously, we need a primary prevention strategy, but I'm not sure that it's effective as a primary prevention strategy at this point in time. So focusing only on primary prevention, I think, is inadequate for the public. So that would be me, just me coming from my particular professional perspective as a public health doctor, and then CPME being the organisation that I came in, looking really to see where this might fit in with CPME. Thank you.
Wonderful. Thank you so much, Ina. What I might do in just a moment, Eleanor, is I might just come to you for a few comments, if you don't mind, around why health professional associations became a constituency, or a little of the background as why they are seen as important. But before that, yes, Ina, I completely agree with all of your points, and certainly adaptation is a significant part of this as well. As I think Fiona was saying too, it's not just the work within the constituency as well. there is that opportunity to be involved across ATACH and things like the task teams. And there's a new task team around standards for climate resilient and low carbon sustainable healthcare facilities as well. One of the things that we've had a lot of discussions about within this constituency is exactly what you've mentioned. It is the impacts on populations, it is the impacts on health systems and facilities. What do we need to do as health professional associations to advocate, to raise that profile? What do we need to do in terms of discussing things like the need for financing as well? What do health professional associations lend to being able to assist that work across the world? And how can we kind of connect some of those dots as well? So there is quite a lot there to unpack, but I might pass to Eleanor, if that's okay, to just give us a bit of perspective about the role of HPAs and where that's come from in ATACH.
So basically, from our side, I think that just as an example, during the WHA, the World Health Assembly, we had the opportunity to meet with different partners, including health professional associations. So once we were discussing with the International Federation of Anesthesiologists, and basically they were telling us how through their constituency, they managed to roll out to all of their national associations a commitment basically to reduce the emissions using specific anesthetics compared to others that were much more responsible for emissions. So basically, we thought it would be great if we could tap with, the potential of all these associations, not only for greening, but basically to understand which are their priorities and how they could help us, because again, they are doing a lot. So basically, just by talking to others, and it doesn't need to be international federations, maybe it's just the National Association of, I don't know, emergency doctors, or because they are all doing a lot. So basically, we thought it would be great if we could create this network just for them to share experiences, to maybe learn from each other, motivate others, and just create this, because we realize that the impact and the potential to really move action is huge. And that's why we consider this specific constituency to be so important. So this first discussion that we thought with Kimberly would be nice to organize is also to hear from you if you have recommendations, how we could mobilize this huge potential, and to bring others on board just to move the agenda forward. And we don't need to be perfect, but just by starting to do something together, maybe we can really roll out this implementation way going forward.
Thanks so much, Eleanor. It's fantastic. And I think, Ina, back to your comments just before, I think a couple of things is that one of the things that we really see with this constituency is that health professionals have such, and their associations, of course, have such a powerful voice that really does speak to the reality of what is happening to people and systems as well. And also, as Eleanor highlighted, that there are significant gaps that I think health professionals are very good at seeing, to say, actually, maybe there's a high level policy or these things should be happening, but we are seeing what's actually happening on the ground and sharing those experiences with other associations too, because some associations are having significant wins in some ways, and being able to share that across the constituency can be quite valuable as well. So not just saying, okay, these are the things that aren't working, but what are the things that are working as well. But as Eleanor said, one of the things that we really need to hear from everybody is what could we be doing differently? What else we could be doing? How can we best mobilize this fantastic group of associations who have all of this experience and knowledge to really create the impacts that we need? And of course, everyone is very welcome to comment as well. You can just chip in, or you can pop your hand up if your tech will let you as well, but we'll go back to you, Ina.
Well, okay, from my perspective, as a public health doctor, I suppose one of the ways we go about things is advocacy. I mean, having an advocacy plan, and really, in a way, it's the planning part is where you really tease out what your goals are and so on. And I'm not quite sure, again, what the goals are here. To me, they're focused very much on the emission side, which is 100% required. However, not sufficient. And therefore, by focusing only on that means that we're failing the public in the way of not protecting them against the things that are beyond the health service. You see, of course, the work I've been working in is environment and health, which is really outside of the health sector itself. It's working with all of the other governmental departments, say within a country. It's within the governmental departments that actually are implementing public health interventions, but not doing it from a health perspective, like say whether it's transport policy, whether it's building policy, and so on. So really, when we're focusing just within the health sector, we're focusing on too small an area of impact, because even if you got 100% success, you're not going to make a big difference. That's the problem. It's great to do it, but it's not sufficient for protecting the health of the public. So to a certain extent, a lot of this is about strategic planning. It's about looking at the big picture, seeing where the areas for action are, who are the allies, who are the, people who are speaking against, and so on, and coming up with strategies, to overcome that. And I think definitely as an allied groups, they're a huge power, but it does come back in the end to the goal of what you want to achieve. If your goal is too small, then your outcome is going to be inadequate. So I think that's where we need to be thinking about really what are we trying to achieve in the first place, because it does take work to focus on something like this. And if the goal is too small, it's not worth it, from my perspective, I would say. And that's only me now as a person and me in my role. But, there's a much bigger task to be done than focusing only within healthcare and on sustainability. If you know what I mean, we have to look at the doctor's role, or doctors, health professionals' role in every area where decisions are being made that impact on people's lives, in relation to both, I think, in this case, climate and health, and I think we're particularly talking about here. Yeah, thanks.
Amazing. Thank you so much, Ina. And I'm sure that I speak for the constituency to say that a sole focus on healthcare emissions is certainly not the aim of this. But I can see that Eleanor has her hand up to provide some more context as well. Thank you.
Just to reiterate the same, maybe I was confusing when I presented my example, but basically it's not just greening. For us and for WHO is very important, and for the constituency overall, the key focus is health systems, both for resilience and low carbon sustainability. And basically, even in many countries, what we promote is that countries should prioritize resilience before going to even greening, because in some cases they don't even have access to water, to electricity, to proper technologies for waste management. And if I give you another example for everything that we do in terms of integrating climate and weather information within early warning systems, there is a lot that we need to do to learn from, for example, again, public health institutes, that is all related to resilience and adaptation. And we want to leverage that capacity, that knowledge, to again, being able to share it with other countries and to advance in this regard at country level. So it's not only greening, it's really everything related to resilience and adaptation in health systems, including greening and also opportunities for integrating adaptation and mitigation within an overall game for climate resilience. So if you can do something in a way that minimizes the emissions, of course, we will promote that technology. Just think about waste management with a focus on resilience rather than emissions reduction.
Thanks, Eleanor. I believe that Paulus was second and then Eugenie. So we'll go to you first, Paulus. Thank you.
No worries. Sorry, Eugenie. Yeah, and I guess maybe whether we might be able to expand on it a bit more, as for me as a relative newcomer to the ATACH arena, I just wondered, because often this sort of dichotomy of adaptation and mitigation crops up a lot, and resilience kind of works well in the middle. But I think I guess when I'm thinking about what the HPA constituency within ATACH can offer. Is the idea that we're there to kind of be a voice for health professionals that then gets taken up into the WHO and to the UN in forums such as COP, so that we can help guide those conversations and making sure that, say, for example, our adaptation processes don't just make the problem worse, that resilience occurs in a sustainable fashion, etc. Is that kind of like that's the mechanism? Is that the kind of nut of where we're kind of heading, like where this work is going? If anyone's able to comment on that.
I think I can comment from the work that we've done. This is a constantly evolving constituency with constantly evolving priorities, as you've probably seen, Paulus, with your involvement in it as well. And I think one of the nice things about it is, yes, so ATACH is sort of a coverall in terms of climate resilience and sustainable healthcare, but also the advocacy that we can do as health professionals about what is happening to the planet because of the climate crisis, which is man-made as well. That's also part of it. I think we can't ignore that that's part of it as well. And really, we can make this into what we think it needs to be most effective and what we want it to be too. So it's really about getting those priorities straight in terms of what do we think as a constituency we need to do and the priorities are. So that was the real focus of our consultations last year. And of course, that is an iterative thing. So we're still taking that feedback, having these conversations as well. Because what we don't want to do is really latch onto something because it sounds good when it's actually not what furthers the work that is needed to protect global communities, health systems, and to kind of further that work in collaborations across ATACH as well. So I feel like that was a very non-concise answer, but it's a little nebulous. Eugenie, I might come to you.
Yeah, great. Thanks. And just going on from what Ina was sort of pointing out, and of course, it is much bigger than just sustainable healthcare, and is a whole focus on health and all policies when it comes to climate change and resilience. But this is, I think, worth reminding ourselves that Health Professional Association is one of 9 constituencies in ATACH and one of 22 on the steering group. So we're not trying to be everything for everyone. And our focus, I believe, and I'm part of DEA, is therefore to really focus on what we can do as health professionals, which I really think, and many people, others have said this, are underutilized force when it comes to addressing or moving forward to net zero healthcare and climate resilient healthcare. So how can we tap in to that underutilized workforce, millions and millions of people across the globe. It's got a great reach and influence the priorities of ATACH and other organisations moving up, and also being able to influence what's happening at the clinical face. So I think we're really well positioned there, and that's how I see it as our voices for this group. Everything else you've said is really important, but as health professionals, and much, much wider than doctors and much wider than the global north, how can we strengthen that wider group of work that WHO and ATACH and others are leading on, and also influence our communities and our health systems to move along on that journey.
Thanks, Eugenie. And I think you've really captured something that was not a challenge, but an interesting tension from the consultations, is that health professionals are not a homogenous group either. So we had quite a variety of opinions about how this work should be done, what the priorities are, and then trying to capture those perspectives, as we did in the consultation, to actually get that into a work plan about what is the work. Is something that I think is challenging and will continue to be something that we need to look at and work through as well. And I think, Eugenie, as you said, Very, very key as well. And always at the top of my mind is this is not just doctors and it's not just the global north. And as a doctor in the global north, I remind myself of that very frequently because what we don't want, once again, is this to be a global north doctors led group that just thinks about the global north doctors things when the reality is that is not most of the world and that is not really representing most of the people who are suffering the impacts of the climate crisis as well. Fiona.
Oh, sorry. Could I just add one more? Sorry,
Of
Fiona.
course.
Just on that, Kimberly, going on what you just said, and I forgot to say, is that position statement that we are developing and would like to develop and present at the next COP is very much open also for consultation. So we would like members to join the HPA constituency and really participate in helping us to develop that. So it should be a consultative process, and we're really open to that. And if others have got ways that we can reach out to the global south and a wider breadth of healthcare professionals, that would be really beneficial. Thanks. Sorry to.
No, thanks so much, Eugenie. And absolutely hit the nail on the head. That is one of the things that is something that we are constantly thinking about is how can we have more conversations with more people who are not just the people in our networks or people that we meet when we go to events or friends of friends, etc. And as Eugenie said, the position statement is certainly not finalised. There is a group working on it who are about to finish the first draft. Then that's going to go out to the wider health professional associations who are already members of the constituency. But we do also plan to send that out as well to groups that are not members of the constituency as well, because we want to get very wide and varied input on that before we launch it out into the world. We really want it to represent as best as it possibly can the needs and wants and really assets of the health professional associations. Fiona.
Hello, I finally got my tech to work this morning, so I'm connected and a reliable source. A few thoughts. I mean, I think Eleanor said it to begin with, it's quite a complex governance agenda. And I wonder if part of the challenge is for healthcare professionals to actually understand what it is they can contribute and also what it is that they can use the mechanism for to really, get issues that are close to their own hearts and the work they're doing onto a global agenda and how we can use that natural energy. Because I guess one of the things that strikes me with my work is that clinicians are often really leading change, and systems and the work that many of us can do can help support them really to have that impact. And so I guess it's a two-way process, isn't it? And I don't know, I'm sure you've thought about that, but it would be great to understand a little bit more about how we can link people in. As we're talking, I guess what struck me is I don't know who you've already talked to. And I realize that there are data privacy and group issues, but part of the challenge is if we wanted to help you and link in more groups, how do we check that the ones that we work with are part of what you're doing? Because you've probably talked to them or you may not have done. I just don't know. And so I guess I'd love them to be able to support what you're trying to do. And the third thing is, I guess, as clinicians, I think we're all super practical people. And there may also be something about getting people focusing in on perhaps one or two things to do, or asking for advice on particular problems or challenges that the ATACH Secretariat are dealing with, whether they're technical problems, things around, I don't know, what, a lot of the work I do is with industry, and it's really helpful to get clinicians' voices and challenges into what we're saying to industry, because that actually then really brings a different voice into the conversation as well. So those are just a few thoughts, but I'd love to be able to think about how we can help further with developing this. And part of it, I think, is, maybe it's my lack of understanding. It was to really understand how to move it forward.
Thanks so much, Fiona. And I think such a key thing, and we would love more ideas and commentary from those on this call, and of course the broader health professional constituency as well, is exactly that. Why why should people be part of this? What can we do? What is in it for them? How does this work? Those are things we're trying, of course, to progress, but I think it is a challenge, as you've said. And I can see that Eleanor has her hand up and she might be able to answer some of those questions as well.
Well, those are very good questions. I don't know if I will manage to respond, but I just wanted to clarify that just by the fact that we have a constituency on health professional associations in the ATACH is basically because we want to hear these priorities by the associations themselves, and we want to promote those within. Basically, being part of the steering committee, having a representative, means that they have the opportunity to integrate this voice and priorities basically in all the global policies and mechanisms. So basically, we are connected, the ATACH is connected with everything related to all the global policy on climate change and health, not only in the WHO, meaning the World Health Assembly, but also any discussions and policies that are related to the United Nations Framework Convention on Climate Health, on climate change. So basically, we are going to organize now this high-level meeting in Paris together with the G7. So we are occupying all the policy sphere, and basically we will have, and we want to promote this voice. So basically that's why we are considering that this is a key constituency, because you are the ones that really know, you are close to the problem. So basically that's one of the points, that basically just by being engaged, the constituency will have the capacity to drive the strategy of the ATACH going forward. And again, probably it's not very clear what we want to do, but we really want first to identify, because there are many things that are happening that we are not aware of. So it's not that this constituency is not doing anything on climate change and health. There are many experiences, there are many initiatives being implemented in different countries by different associations of professionals. So first, we want to know what is happening, again, with the aim to potentially motivate others by bringing those associations together, and then try to identify maybe a priority action, either with regards to adaptation or resilience. Is going to be different for different associations and professionals, and maybe try to champion that globally, nationally, regionally, just to see how things evolve. We don't want to do everything from day one, but just to build this ownership, or this community of practice, let's say, that basically will allow action to move going forward.
Thank you so much, Eleanor. Joanna, I can see your hand up.
Hi, everyone. I'm Joanna, and I'm with the World Medical Association. So we are an international organization for everyone who doesn't know us, and we do have representation quite a bit from the global south, although I'm not. I'm from Austria. So from what I gather, what you just said is like we are considering joining the constituency. So the point of joining right now for professional association would be, or the main point would be, that we could help shape the agenda of what the constituency is going to work on, as I gather, because I've also been waiting for more specific or concrete advocacy plans, or so. But is this correct? The main point would be we can help to shape the agenda in line with the policies we already have. Okay, yes, I see a lot of nodding. So the other point, and then now I'm not speaking for WMA, but just from my professional background, I primarily work with the primary care sector. So I'm a GP by training, but also a public health professional. And I do research primarily focusing on primary care and climate change. And my main issue is that it's very hard for people in primary care in practice to link or to see the importance of getting involved with policy. So it has to be really specific and and that's something I see that we are lacking. Also, if we look at, for example, at the major frameworks we work with right now, for example, the operational framework, primary care is, I think it's like, there is one sentence that we need to shift care to primary care in order to reduce our emissions. But apart from that, it's not very specific. And I know it's different for different countries what has to be targeted. But when we communicate, or my experiences, it's when I communicate with people in the field, and if we want to engage them and engage their voices, and those are really, like, primary care is right there on the front line, and they are engaged with the communities. So if we want to get them active, we need more specific guidance. And I think it could be a priority to shape that one, because it's, I just want to throw it into the room, but sometimes I try to explain where the link between policy and ground level action is, but there is a gap and a disconnect. That's what I see. And we need to work on how do we communicate why it is important to work on that level and why it is important to raise our voices. And so far, the guidance I've been seeing is very broad and very general. I don't know whether anybody has an idea to make it more specific. There are some good guides, but it's sometimes I find it really difficult to give them a hand. And I mean, they are very short on time. They usually have a very, very short time slots they can use to for advocacy, for example. So we have to give them more help to raise their voices.
Thanks so much, Joanna. Fantastic. And yes, thank you to you and your colleagues. We've had discussions with WAMA previously around ATACH. And I think that is exactly why we need voices such as your organisations, your associations within this work as well, to say this is the gap. And certainly this is something we have talked about a lot, is that gap between policy and practice, and what are the things that we need to do as well. And I think as Eleanor mentioned too, one of the things that really gets me energized and excited about this work is that it's open to all of these different ideas, but there's such a fantastic platform to elevate this work globally and to say this is what needs to happen and make it happen, to have that priority ask that we can really elevate to high levels, to take that kind of work that you're just talking about, Joanna, and go, this is actually what needs to happen and this is how we do it as well. So we'd very much welcome future conversations. And I completely agree. I think that sounds incredibly valuable. Any other comments, discussion? We have a little bit of time left. Or any questions, any clarification, anything anyone would like to add?
Sorry, I can't raise my hand. Oh, sorry.
Thanks, Fiona.
Was it Ina who wanted to?
Well, I don't want to come in ahead of Fiona. She's got her hand up. I mean, legally.
No, you go first.
Will I go on? Okay. All right. Yeah, I'm just thinking about this. I mean, I think Eleanor mentioned there about things like, and we're thinking about globally. So we're thinking about the basics, really the basic requirements for health, clean drinking water, clean air, looking at, the safe waste management and so on. And if we're looking at that, they're all, again, public health interventions being managed usually by people who don't have any health training. And if we get down to the basics of that, really, we're going way, way, way beyond the health system. I mean, I'm hearing about climate resilient healthcare, but resilient healthcare is almost waiting too late in the day. If we mean that we're talking about responding to ill health, if we're talking about prevention, then that's fine. But I mean, the WHO emergency response cycle, really, I see an awful lot of work focused on preparedness and response, but very little on the prevention, which is the day-to-day, getting rid of the existing vulnerabilities and the inequities, which are global as well. And, from a strategic perspective, again, you have to think about what is we're actually trying to achieve. Are we, in the end of it, the most impact will come through getting the basics right in certain respects, but also, recognizing that many of the the populations of the world are being impacted by the over-consumerism of certain parts of the world in certain respects, and living different types of lives and so on, and where there's very little effort or maybe investment in supporting people who have already been impacted through no fault of their own by others. And if we're not going to get into that area, I don't know exactly where are we going to get into it, because again, focusing only on what we can do to fix our health services isn't sufficient. It's too small. It's just not going to make a difference. It's essential though, of course, so it should be in there in the pot, but it isn't enough. And I'm keen to really see where are we trying to really make the biggest impact. And and I think it is health professionals' voices are important to be heard in the decision making outside of the health services and where policy is being made. I think what Joanna was saying there about within primary healthcare, if people are just focusing on their job that they have in front of them and they're not thinking about the bigger picture, they won't really know what to do. And I think I don't know where this discussion is being had. I can't see it anywhere, and I don't see people are looking at the big picture and saying where are the priorities, working from first principles, really looking at human need and where are the and tracing through the cause, the initial causes and the impact, the environmental chains of impacts until they affect human beings. I'm not seeing anywhere where that sort of work is being done, and where the commercial determinants of health are being looked at, how they're impacting on all of this decision making that's going on. And if doctors and other healthcare, I'm sorry I keep saying doctors because that's where I work, but if healthcare professionals' voices aren't heard in there, then that unethical element of decision making that's occurring day in, day out at very high levels throughout the world isn't being exposed in a way. The unethical decision making, though changing that's would make it very difficult. But if that's not really again on this particular, we're thinking it's too hard to do. What are we trying to do? That's what I'm just not clear yet. What exactly our purpose is. Yeah, thanks.
Thanks so much, Ina. Wonderful. Fiona, I'll come to you. We've only got a couple of minutes left.
Yep, I'd be very brief. Just to say, I thought your summary that you did about what this could be for was fantastic. And it's that passion and that clarity of what the potential for this is, as Eleanor was saying, ATACH is in all the right places and making all the right people come together. The challenge, I think, when you work in WHO, and I say that having worked in it, outside it and in governments, is that by nature, we're very process driven. We bring people together through networks, and yet the people you're trying to attract are individual professionals who are used to doing things. So there's something, as you just described, about bridging that, and it was Joanna's reflection as well. So I think, it's how you make it really easy for people to understand what it's for, what the potential is, and try to keep the WHO processes light so that people can get the potential for the impact they can have, because it's a fantastic initiative and happy to support all I can.
Thanks so much, Fiona. And thank you to everybody. I can see we are going to have to wrap things up. It's been a really wonderful and I think challenging in a good way conversation as well. So we will move along to our next slide if we can, please, which is just next steps and closing remarks. So I think in terms of next steps, the advice on how to join this constituency is on the website, and I'm sure the team at WHO can also point those of you who feel ready to take that step in that direction. But I think equally as well, and I'm speaking for the others from Doctors for the Environment who are here today as well, and Eugenie, who'll be chairing our next session too, to say we would be more than happy to have further conversations and debate and explore the whys and whats and hows of how this might work as well, and have those conversations. So please do reach out to us just to have a chat if you feel like your association is not quite ready to join, or do both. And I'm sure we'd be quite happy to be involved in that as well. My closing remarks I will keep brief as well, and then I'll just pass to the WHO team and Ellen to see if there's any other things that they would like to add. But just to say that thank you all for coming to this meeting today and to being part of this conversation as well. This certainly is work that is in progress. I think it is such an incredible opportunity. We don't want to waste it. We really need to look at how we can do this in the best possible way we can. How can we make this the most impactful constituency that we can possibly make it? How can we tick those boxes and get those things done for not only for health professional associations, not only for health professionals, but for communities across the world who are relying on this work being done. And I think there's so much possibility, and we would love for you to be a part of it. So please do reach out to us. Eleanor, I'll pass to you just for a couple of comments if you'd like to.
Really nothing much to add. I think that the conversation was quite useful in the sense that we realized the many challenges ahead, but also, I mean, we continue to be motivated to find the mechanism to make this work. So basically, well, I really appreciate all the comments, all the inputs, and then we'll be reaching out to others to try to understand better also how we can do this together. So thanks very much. Yeah.
Thank you so much, Eleanor. And my last remark that I will add is if any of you know of any other associations or any other people who you go, oh, it might be good if they had a conversation with us as well, please get in touch too. I think our doors are extremely open, and obviously there's a lot of passion for this work too. And there is a QR code. So yes, please join if you'd like to. Thank you all so much. And just a reminder, I'm sure that none of you will need to attend the other consultation, but there is another meeting later today, which Eugenie will be chairing. And yes, we look forward to connecting again in the future. Thank you all so much for your time.
Thank you. Bye.
Bye.
Right. Great. Thank you. Bye.